Chapter 2, Child Abuse and Dependent Adult Abuse. Chapter Objectives. Review the meaning of child abuse as defined in Iowa Code Section 232.682 and the meaning of dependent adult abuse as defined in Iowa Code Section 235B.25 and 235E. Review statistics of child and dependent adult abuse. Child abuse is not a new thing. It's been documented for more than 2,000 years. The first documented legal response to child abuse in the United States occurred in 1874. The New York Society for the Prevention of Cruelty to Animals pleaded in court to have an 8-year-old child removed from her abusive and neglectful environment. Since there were no child abuse laws, the society argued that the child was, in fact, an animal and should be provided the same protection as other animals. Child abuse is now recognized as a problem of epidemic proportions. Child abuse has serious consequences that may remain as indelible pain throughout the victim's lifetime. The violence and negligence of parents and caretakers serve as a model for children as they grow up. The child victims of today, without protection and treatment, may become the child abusers of tomorrow. As with any social issue, child abuse is a problem for the entire community. At CHI Health, we take this seriously. It is up to all of us to keep a caring eye on the children and families who come through our organization. The victim of child abuse is a person under the age of 18 who has suffered one or more of the categories of child abuse as defined in Iowa law. A child is defined in Iowa Code Section 232.68 as any person under the age of 18 years. The abuse is the result of the acts or omissions of the person responsible for the care of the child. Maltreatment occurs when a child aged birth through age 17 is physically, emotionally, or sexually harmed. This definition includes both abuse and neglect. A child is defined in Nebraska as any person under the age of 18 years. 390 NAC 1-001. The abuse is the result of the acts, abuse, or omissions, neglect, of the person responsible for the care of the child, includes parent, guardian, custodian. Notice that the only real differences between Iowa and Nebraska code on child abuse is how the codes are worded. This course will often refer to Iowa's code and language, as it is the more stringent of the two states in its requirements for training. Be assured that this course fully prepares you to be knowledgeable and competent in your responsibilities around reporting abuse or neglect for both states. Child abuse occurs whether we acknowledge it or not. It happens right here in Iowa and Nebraska. The actions we take, if we suspect it, can mean the difference between life and death for a child. According to Iowa statute, the Department of Human Services, DHS, has the responsibility to assess reports of suspected child abuse. DHS is the agency designated by law to receive reports of suspected child abuse and neglect. In Nebraska, it is the Department of Health and Human Services, DHHS. In calendar year 2009, Iowa DHS accepted 25,814 reports for assessment and confirmed that abuse occurred in 34% of the assessed reports. In Nebraska, DHHS accepted 14,039 reports and confirmed that abuse occurred in 25.1% of the reports. Let's do a little comparison here. Nationwide, in 2008, the rate of confirmed child abuse and victimization was 10.3 per 1,000 children. And here in the Heartland, in Iowa in 2009, the rate of confirmed child abuse and victimization was a startling 15.6 per 1,000 children. In Nebraska in 2009, the rate of confirmed child abuse and neglect was 7.8 per 1,000 children. Did you encounter 1,000 children over the last year in your workplace, neighborhood, community? Probably. Well, at least 7 and as many as 15 of them were probably abused or neglected. Did you notice? How can you tell? Chapter 3 will give you more tools and information. In Iowa and Nebraska in 2009, where abuse was found, roughly half of abused or neglected children were age 5 or younger. This is similar to past years. Here's a view of what investigators have been finding. The most common abuse for children is actually neglect or denial of critical care, food, hygiene, shelter, wound care, and so on. Physical and sexual abuse make up 13% of the confirmed abuse cases in 2009 in Iowa. Notice the category presence of illegal drugs in body. 4% of confirmed cases were in this category. In Nebraska in 2009, the most common abuse for children is also neglect or denial of critical care, food, hygiene, shelter, wound care, and so on. Physical and sexual abuse make up 14% of the confirmed abuse cases in 2009 in Nebraska. Notice the categories in Nebraska called emotional neglect and emotional abuse. 5% of cases are of these types. Iowa and Nebraska categorize child abuse and neglect types slightly differently, but they cover the same territory. In Chapter 3, you will learn more about the types of abuse and what you should look for in the children who come through CHI Health and the children in our communities. Now let's shift to another group of people who rely on others for basic care. Adults who are 18 years and over who cannot care for themselves are considered dependent adults. We as a society and as employees and volunteers of CHI Health are responsible for ensuring their protection and well-being. Dependent adult abuse allegations involve people who are aged 18 or over and are incapable of adequate self-care due to physical or mental conditions and require assistance from other people. Dependent adults may be elderly or may have diminished physical or mental capacities that prevent them from meeting their own needs adequately. In Nebraska, dependent adults are also called vulnerable adults. Types of dependent adult abuse in Iowa include Types of dependent adult abuse in Nebraska include physical abuse, sexual abuse, financial exploitation, denial of essential services, and self-neglect. Again, you can see that Nebraska Code does not differ in substance from the Iowa Code. They both provide protection in the same essential areas in which dependent adults are vulnerable. Note that there are two kinds of dependent adult abuse: abuse of the elderly and abuse of adults who cannot care for their own needs because of physical or mental disability. In the next slides, we'll look at these two groups. Elder abuse is commonly defined as abuse of adults aged 60 and older. Researchers estimate that only 1 in 14 incidents of elder abuse actually come to the attention of law enforcement or human service agencies. Elder abuse is one of the most under-recognized and under-reported social problems in the United States. It is far less likely to be reported than child abuse because of the lack of public awareness. Nationally, it is estimated that over 55% of elder abuse is due to self-neglect. Such abuse can happen anywhere, in private homes, at healthcare facilities, and in the community at large. Here are the most prevalent types of elder abuse happening in Iowa in recent years. We'll explore what others refer to when we get to Chapter 4, but notice how the most frequently occurring elder abuse is neglect, denial of critical care, and physical abuse, a similar finding for child abuse. Here are the most prevalent types of elder abuse happening in Nebraska in recent years. Note that in this report, self-neglect or self-denial of essential services is combined with denial by caretakers. Like Iowa, neglect is the largest confirmed finding in investigations into elder abuse. Iowa Code has separate chapters for where adults are residing. Notice that a distinction is made between dependent adults in the community, those receiving residential care living in private homes, and dependent adults living in a facility. Founded abuse means the abuse was found or confirmed when investigated. In Iowa in 2009, this is the breakdown of where adult abuse was occurring. Over 90% of cases happened in organizations with policies, licenses, and oversight that should prevent this from happening. Only 10% happened in the privacy of a household. In Nebraska, Adult Protective Services provides oversight and regulation for the protection of vulnerable adults, regardless of where they are living. Dependent adult means a person 18 years of age or older who is unable to protect the person's own interests or unable to adequately perform or obtain services necessary to meet the essential human needs as a result of a physical or mental condition which requires assistance from another or as defined by department rule. So you can see that the elderly are not the only adults who might be unable to meet their own needs. In both Iowa and Nebraska, the laws protecting dependent or vulnerable adults applies to persons with mental or physical disabilities which prevent them from living independently. Now we'll turn to the reporter, the person who, in the course of working or volunteering at CHI Health, may suspect abuse of a child or dependent adult. We'll introduce the two types of reporters of suspected abuse, mandatory and permissive. Iowa law defines classes of people as mandatory reporters who must make a report of abuse within 24 hours when they reasonably believe a victim has suffered abuse. These mandatory reporters are professionals who have frequent contact with children and dependent adults. In Chapter 5, we will examine in detail requirements, provisions, consequences, processes, and more about reporting suspected abuse in both Nebraska and Iowa. A mandatory reporter is defined as a person who, in the scope of their professional practice, official capacity, examines, attends, counsels, or treats a child or dependent adult or reasonably believes the child or dependent adult has been abused. Iowa state law identifies these major disciplines that are required mandatory reporters. Nebraska also has mandatory reporting requirements for healthcare professionals, healthcare facilities, human service workers, daycare facilities, and so on. Mandatory reporters must report suspected abuse within 24 hours. Let's be more specific about who might be a mandatory reporter. This is a huge list of mandatory reporters. The point is that there are a lot of us professionals out there trying to make a difference. The Department of Human Services has tried to make mandatory reporting mandatory for as many groups as possible in order to increase the chance that we can save someone from abuse. What if you're not in your official capacity, not acting in the scope of your professional practice, and you suspect child or dependent adult abuse out in the community? In this case, you are what's called a permissive reporter. A permissive reporter is anyone who thinks that abuse may have taken place and is not currently in their official capacity, Scope of professional practice. Over 1/4 of founded cases are reported by permissive reporters. Nebraska has a similar law to Iowa's in that citizens are required to report suspected abuse or neglect to local law enforcement or the Department of Health and Human Services. In Chapter 5, we'll tell you exactly how to report in both Iowa and Nebraska if you're out in the community. And of course, we'll tell you exactly what to do if you are in your official capacity as a CHI Health employee or volunteer and you suspect abuse or neglect. A dietary technician brings a food tray into Grandma Lee's room. Bobby, her adult grandson who has Down syndrome, is visiting, along with several other adult family members. Bobby is wearing a short-sleeved shirt and the dietary technician notices several elongated dark bruises on his arms. Bobby helps his grandma with her food tray and accidentally knocks it to the ground as a dietary technician is walking out of the door. She hears one of the adults shout, "Bobby!" Then she hears Bobby say, I'm sorry, don't get the belt, I'm sorry." Should the dietary aide do anything besides help them clean up? A. Help them clean up and bring in another tray, but that's it. Don't bother anyone else about it. Or B. Help them clean up and bring in another tray, but then do something more. Go to the professional staff assigned to the patient and describe what happened. Ask them to take appropriate next steps. You could do A. It may be tempting to stay out of it. Who knows, you might make things worse, or perhaps you are misreading the situation. Besides, who are you to step into another family situation? Just help them clean up and bring in another tray. However, answer B is the more appropriate response. Talking with the professional staff assigned to that patient may be one of the few answers that is always right when you're unsure what to do about suspected abuse. They have context and some history with the patient and family, so they can interpret and make a judgment call about reporting. Also, your consultation with them puts them on alert that there may be reason to keep a careful eye on the family to provide members with support and possibly protection from abuse or neglect. In this course, we'll give you information about who inside CHI Health you could consult with and what information they might need from you. As a mandatory reporter, please note that you only need to have a reasonable cause to believe that abuse or neglect has occurred. Your role is not one of investigation or validation that abuse or neglect has occurred. That will be done by the state officials when they do their assessment. The CHI Health reporting procedure in Policy 800.006 is written to ensure that how we make reports fully meets the legal requirements of both Nebraska and Iowa code. In the case of Bobby, there is reasonable cause, so go talk to a member of the assigned professional staff for that patient.